the reality is that oftentimes AI isn't a necessity or isn't even applied in certain portions of the process to make it better. But it's the impetus for change. And there's a bit of a double-edged sword there. We've started to see some people involved in health plans on the regulatory side, when they hear AI, get a little nervous. So it's really important that we continue to maintain the benefit of AI as a topic, but also realize that it doesn't have to be the true AI of, scary movies, right? It can actually just be good technology. It doesn't have to be AI. AI is a intelligent rules engine. So we can add things to the process that are technology driven, that are good uses of technology, and AI may or may not be a part of the actual pieces of the process that people are using.
It's interesting that you bring that up because one of the topics that we've been talking a lot about recently is touchless prior authorization. And most people assume when you say touchless prior authorization that you're talking specifically about AI, but that's not always the case. So what does touchless prior authorization mean? How does it impact providers? And what does that mean for payers?
Yeah, that's a great question. So when you think about the process, right, the first step in the process is for the provider to be able to know, I just created an order, is a prior auth required? There's different degrees of touchless in this scenario. One degree is the current way things can happen, which is a provider goes out to a website and asks a question or determines if prior authorization is required. And the easier that process can be, the least amount of work for the provider, can be called touchless. The next step of evolution in that process is where the electronic medical record system in the background is asking the payer's system if a prior authorization is required, and showing that up, bring that up on the EMR system in the middle of the workflow, right? So that's the degrees of touchless. The fully touch is where the provider has to pick up the phone and call the payer, right? So there's degrees of touchless just in the determination of, is an authorization required? When it comes to submitting the prior authorization, there are multitudes of systems that will look at prior auth requirements and gather the correct information inside of the EMR to assist the provider in submitting that prior authorization.